Good evening, thank you. First of all, I want to thank the organization for having the opportunity to share with you and for having me to explain to you how difficult it is for us to put on the ground all we have planned on 2014, as the president said. How we tackle with the main problems, the main health problems in our country, in our decentralized country. Let me show you how we do that, what we are doing now, and what are our main challenges for our future. Let's say Spain has a decentralized country, and it is a national health system, but there are 17 regional healthcare services. So the aim of the Ministry of Health is to coordinate the national health system in order to maintain quality, in order to enforce equity, and to maintain the cohesion in our system. So then we have many tools, and among those tools we have strategies on health. Strategies on health are defined on a collaborative way between, let's say, a technical committee that is composed by scientific societies, patients association, some experts, and another committee that is composed by the autonomous regions. And those committees set up strategy that must be approved by our interterritorial council, that is the most important and the main organ of cohesion in our country. So once all the strategies have been approved by the interterritorial council, it's up to the autonomous regions to put on the ground and to develop plans, concrete actions and regional plans to implement what the strategies say. So that we have some approved strategies. We have cancer care, cardiopathy, we have palliative care, and we have a chronic conditions strategy, a strategy for addressing chronicity that was set on 2012. And is inside that strategy, we think that the most important problem, one most important problem was chronic pain. So then we developed a national plan for address pain, taking into account the main guiding principles of our national strategy for addressing chronicity, that our people are the center of the healthcare system. It includes all perspective of all life cycle. It's about all chronic condition, but not dealing with particular diseases. And taking into account that the most important is put the patient and citizen in the center of the system, and then to facilitate the continuity of care, and of course enforce the patient empowerment. Then you have an English version, a reduced version of our strategy if you want to consult it. So taking into account that chronic pain is the most important chronic condition in our patients, we set up main document, let's say, about pain management. It was inside the implementation plan of the national strategy for addressing chronicity. But soon we realized that pain was not only related to chronic condition, but it was a transversal item to take into account. It's not only chronic condition, it's acute pain, it's perioperative pain, it's pain related to procedures and so and so. So on the implementation plan, we include not only pain management, but other items that from the Ministry of Health we can aid the autonomous regions to implement those strategies. And then to implement the strategy for addressing chronicity, we develop a national strategy for health promotion and disease prevention. We develop our health school network for citizens in order to improve the health literacy, let's say, of the patient's empowerment. We perform inside our HTA network, or Health Technology Assessment network, all that products that are needed to implement and to be analyzed by all the agencies. referring to chronicity and, of course, with pain. We have our national framework document about pain that was set up in 2014, and we have 2 IT tools, the population stratification and other IT tool about process management, chronic process management. And then we have our best practices. Those activities, we are launched those activities from the Ministry of Health, as I said, to help the autonomous regions to implement the strategies. So what about pain? We have our framework document with our high broad scope, and it is a prioritized health problem because, as I said, its frequency, the impact of in the quality of life of people. And one thing that it's very, very important for healthcare services is that a biopsychosocial orientation is needed to well address pain. So then autonomous regions began to implement those strategic lines and those recommendations, those goals that are strategic goals, let's say, that the concrete actions must be developed by the autonomous regions. So, those are the strategic lines. Just to remember, it's obvious that pain must be prevented, pain must be assessed and systematized as a 5 sign. It's needed an integrated approach. We need patient empowerment, we need to reduce inequalities, and we need trained professionals, trained patients, trained citizens, and of course to research. So those strategic lines are deployed on specific goals and recommendations. So we detect some key elements in order to help the autonomous regions to define their autonomous plans. And those key elements that we have identified in order to, let's say, prioritize the actions was raising awareness of population, to promote training of professionals, to take into account pain as a mainstreaming element that is present on every healthcare action, that we need an integrated care, that we have to enhance intervention in, as for instance, self-care, and that it was very, very important to take into account not only pharmacological treatments, but not pharma treatments as well. So, taking into account these key elements, autonomous regions have implemented their plans. And what have we done so far today? We have many regional plans on different, let's say, level of implementations, but we have many key elements that I want to highlight here. And we think that it's very important that from 2014 and today, taking into account how difficult it is to implement those plans, many regions have achieved that goals that I show you at the slide. Main management regional plans are implemented on every region and almost on every region, and are about to be launched on the regions that not have implemented that plan. There are, on many regions, there are technical committees that assess pain at the regional level. In other regions, they've implemented hospital pain management committees, or taking into account primary care and hospital care pain management committees. We have patients empowerment put on the ground with our network School for Citizens. We have we have schools for citizens on every region, and pain is a main item to empower patients on every region. Pain management in children is implemented at least on 4 autonomous regions. And that's very, very important because all we know that children are special in the assessment of pain, not only prevention but treatment and how children feel pain is very, very different from adults. So we very, very enhance these actions that have been implemented on 4 autonomous regions. On every region, they're implemented the assessment of pain as a 5th sign. It's very, very important that in many regions they've included on the clinical history and the IT tools they have. And then we perform a pain prevalence assessment almost every 4 years. In our national survey, there are at least 4 or 5 answers about pain in order to know how do patients feel pain. And we have implemented KPI in hospitals, on many hospitals, not all hospitals, but in many hospitals. And we have some KPI at a national level related to pain. So we've done some things and not 100% implemented, but we are on the way. That is important, because if we are on the way, it's not easy to go behind. So for us, it's very important. This is our main items for our health goals network for citizens that are focused on health literacy, patient empowerment, social and emotional support, patient safety, health decision-making tools, and Health 2.0. And last but not least, here we have our best practices. This is a project that we launched 4 years ago. It is 4 years ago, and we've many calls about best practices that are focused on strategies on health, not focused on a concrete item, but on the strategies on health that have been approved by the Interterritorial Council. A best practice is not a practice that is good. It is a practice that has proved effectiveness, that has proved that it could be scaled up, it could be transferred to another region, and that is aligned with the main objectives of our strategies. So then you have the link to our best practices, and we have a common criteria for best practices, because in our let's say not so easy to manage system, we have to reach the consensus about our criteria. So we have common criteria that has been approved by the Interterritorial Council, and those criteria are this. Let me highlight that one of the most important criteria is effectiveness. The best practice must show results, and the transferability. Transferability is essential, because it is not useful that you detect one practice if you can transfer it into another region or another hospital and other services. So we take into account the gender perspective as well, and participation, cooperation, efficiency, sustainability, appropriateness, relevance, evidence-based medicine, and all these 11 common criteria of our best practices. But let's say that we highlight the transferability and the effectiveness as the main important criteria for select a best practice. There you have a photograph about the day we give the awards to the teams that have achieved the recognition. And let me tell you that it is a very, very special day, because we put together hospital managers, we put together regional managers, we put together general directors from the Ministry of Health, medical professionals, nursery professionals. So it's very, 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 very emotive, let's say, day, because they feel recognized the day-to-day work in a simple piece of paper that say, I hold a best practice for the national health system. So We are very enthusiastic about this project. Now we have 225 best practices selected about those strategies on health. We have reproductive health, domestic violence, cancer, palliative care, diabetes, rare diseases, rheumatic and musculoskeletal disease, and COPD up to now. But if you see those items, you realize that on every of these strategies, probably they will have best practices about pain management. So that's why our challenge today is that our great news today is that we have just launched our 217 call for best practices that includes chronic pain management. We are very aimed to detect best practices about management of chronic pain, and we're very excited to know what regions are doing, what the services, what the hospitals are doing to implement the framework document about pain, because it's the only way to put on the ground, to look what professionals are doing on a participative way in order these best practices to let's say flourish and to be public and to be copied by other regions. So we've recently launched our call. It includes not only chronic pain management, but palliative care, that we have focused today on palliative care in children. And we have also COPD and ischemic cardiac disease, and we have many strategies, but concretely we are very interested on detecting best practices about chronic pain management. So the challenge we have is to scale up these practices. Once we have detected these best practices, we have to enhance the autonomous regions to copy these practices and to implement in another region or in another hospital or in another service. This is our 2018 challenge for pain, but nowadays, we have a present challenge to scaling up many best practices that have been detected many years ago. And concretely, we have 2 best practices to be scaling up. And we are very excited about this project, because, as we said at the beginning of the day, is the only way to put on the ground and to put on reality what we have said on documents or on strategies. Let's say that what we have to do is clear, but now someone must tell us how to do it. And professionals and patients are the better to inform us how to do it and how to achieve the best results. So thank you so much for your attention.